you feel safe in this city?
No, no way. No way. When you see the people using drugs in the street, and who's gonna be safe? Like, that person is not gonna save.
My 21-year-old son, William Bernard, passed away in April 2022 from laced Xanax.
Is New Dawn provides safe supply? Yes?
Wait, what is it? Safe supply. Oh, yes. Drugs? No. Safe supply, yes.
So I'm reporting from our nation's capital, the city of Ottawa, a city which all Canadians should take pride in and should want to visit. The situation, however, is pretty bad. Ottawa, like cities and towns all across Canada, is being decimated by record levels of homelessness and an opioid overdose crisis, the signs of which you can see all over the city. In 2023, Ottawa saw 188 people die from confirmed drug overdoses. In 2024, that number reached record levels, with 244 overdose deaths. First, let's address the homelessness situation in Ottawa, one that has reached record levels in recent years. The City of Ottawa's 2024 assessment on homelessness found that if additional funding isn't put into building homes, shelters, and transitional housing, homelessness in Ottawa could increase by 58% over the next decade. There could also be an additional 133,000 people at risk of experiencing homelessness during that time period. The city also has broken down homelessness by demographic, and it's an interesting stat to consider when addressing the City of Ottawa's numerous problems. Indigenous Canadians in Ottawa are disproportionately homeless. They accounted for 19% of people in the 2024 point-in-time count, despite making up only 2.6% of the city's population. Another interesting angle here about homelessness in Ottawa is that 42% of the total homeless population also identified as an immigrant, refugee, or a refugee claimant, due to a, quote, substantial influx of newcomers, asylum seekers, and refugee claimants in 2023. Now, it's arguably even worse when you look at the opioid overdose situation in this city. According to Ottawa Public Health, we have seen a significant increase in the harms of fatal and non-fatal overdoses since the start of the pandemic, and unfortunately rates have remained elevated. And the data backs this up. The most recent data from Ottawa Public Health regarding confirmed opioid overdose deaths shows that leading up to 2024, in the third quarter of 2024, the latest data that we have, these numbers have not decreased. The peak quarter was the first quarter of 2023 in Ottawa. I'm standing here in Ottawa's busiest tourist district, the ByWard market. You would think that it being the nation's capital and this being the major tourist hub of our nation's capital, it would be thriving with tourists, a safe place for young children and families to come enjoy their time here in the nation's capital. But that just isn't the case. So today I'm here to investigate what has happened to our nation's capital, to our once proud nation's capital, how the situation with homelessness and addiction has gotten so bad here. To speak to residents, maybe to speak to people using the services to get clean, using services to recover, to see if they're willing to talk. And we'll also be speaking to experts on the front lines of this crisis, trying to do what they can to fix Ottawa and the people that are struggling here. So we're walking along King Edward, and this is an example, I think, of what many Ottawa residents are so concerned about and frustrated about, which is the visible signs of open drug use. Pipes, needles, outside of what appears to be a former church, and potentially is now a shelter facility. It's just not a cleanly situation. And it's sad to see this. It's sad to see this and so many other examples in our nation's capital. You can see these white plastic, what appear to be buttons. That's naloxone. That has been administered, it appears, twice to someone who has overdosed, who's experiencing an overdose, to revive them, to keep them alive. That's a visible sign of the crisis in the city. We're now walking to Rideau Center, along Rideau Street, literally just a stone's throw away from Center Block, from Parliament Hill, the crown jewel of Canadian democracy. And again, you can just see the visible signs of homelessness and addiction affecting this city. Now, two recent changes to provincial legislation have tried to address the safe supply crisis and the homelessness and addiction crisis by the provincial government. The first was a decision to restrict safe consumption sites. That is basically a place where an addict, someone struggling with substance use, can bring their hard drugs, their dangerous drugs, and inject the drugs in a specific site, in a safe consumption site. The decision was to ban those sites from operating within 200 meters of a school, a child facility, or a daycare. The second decision by the provincial government was to shut down any safe supply programs that receive provincial funding. So that doesn't mean that safe supply doesn't exist. In fact, there are safe supply facilities all over this city, but no program that receives money from the provincial government can offer hydromorphone tablets to people suffering from opioid addiction, Dilaudid pills. This is a potent heroin alternative, a pharmaceutical heroin alternative, which is more potent than heroin. The idea with these pills is, people are going to receive these pills, and that's going to deal with their urges to take opioids. But the problem with Dilaudid, the problem with safe supply, is diversion. When people who are addicted to drugs go to facilities, receive hydromorphone, take the pills they get for free, paid for by the taxpayer, and then sell them on the street, sell them to youth in many cases. And that eventually gets them hooked on opioids. You can see how it is a self-fulfilling problem that just keeps compounding. The provincial government in Ontario has decided to put a stop to that. The Alberta government also has decided to put a stop to that. And in British Columbia, they recently abolished their Ministry of Mental Health because they are now also taking a different path. The tide is shifting on safe supply, not just in Ottawa, but across the country, because the results have shown us that it has been a drastic failure. That's at least what the data shows us. But we'll be speaking later to Rob Boyd, the CEO of Ottawa Inner City Health, a facility that has been providing safe supply to addicts. I want to get his side of the story. I want to learn why he believes safe supply is important in Ottawa, and the counter-argument to what we're seeing across the political spectrum from politicians and activists who say this program is not working.
Well, I think that, with addictions in general, with opioids in particular, but specifically within a toxic drug crisis, you need to embed your recovery strategy within harm reduction. You just absolutely have to. This is a very complex, the substance use and substance use disorder are very complex kind of psychosocial issues that take a lot of time for people to recover. So there's not really an awful lot of one and done type treatment services out there. So you have to have harm reduction strategies embedded within all the stuff that you do. And from our perspective, there's no distinction between treatment and recovery and harm reduction. They're all part and parcel of the same process for people. And that, getting people into treatment is a very good harm reduction strategy for many who choose to do so. So I think that there's this false dichotomy that has been created in the political narrative between treatment and recovery and harm reduction, that people on the ground, people who are doing the actual practice, do not see that distinction the same way, and that you really need to think about how challenging it is for people to change their behavior, particularly those who are experiencing significant barriers to recovery. A lot of people might think about, what's popular on TV shows like Intervention, or if you just watch shows about people who go into treatment and kind of turn their lives around, and those things can and do happen, but it's because they have a lot of other assets in their lives that are supporting their recovery. So they've got a family, they've got a job, they've got some education, they've got things to lose and things to gain if they change their relationship with substances. For the people who are the most marginalized, who we work with, they don't have those things. And so there's really nothing to compete with the drug use. So again, we go back to saying, well, let's create some things, some positive things happening for people. And that to us is treatment. That to, if we put people into housing, that's treatment. If we get them doing something with their time, recreation, occupation, some work, that is treatment, because these are things that we all take for granted. And these are things that we know are actually protective of people. In terms of developing substance use disorder. So we're starting from a much lower baseline with people, but we've seen time and time again in our programs that people do respond to this, and people do over time develop this sense of community and sense of belonging. But we have to be very consistent with people and never give up on them over a number of years in terms of providing care for them, and that is kind of the core of what Ottawa Inner City Health does.
One of the largest criticisms that we have seen towards safer supply facilities and clinics is that there's not enough being done to prevent diversion of hydromorphone, of Dilaudid, out into the community. Obviously, that is a big issue because it's been addressed in the media in many instances. What is your organization doing to prevent diversion of safer supply?
Yeah. So we, one of the advantages of Ottawa Inner City Health is that all of our programs are 24/7 programs. So we have eyes on people a lot of the time, and so we get to know them really well. We get to know how it is that they're doing, and also the people around them are doing. So it's actually much easier for us to see that something is different, or to witness or to identify that diversion is happening within the program. So it somewhat depends on the circumstance for it. If we get a sense that somebody is taking this medication and they are selling it, and it's something that's going outside of the community to potentially an opioid naive population, that would be a reason for discharge from our safer supply program. If the motivation for diversion is that it's a friend of theirs who is dope sick, and so they want to share their medication with them, we might want to consider, can we get that other person onto the safer supply program or onto an OAT program, whatever it is that they want. We can address that. Sometimes it's a purely financial thing that they need money. So we say, well, are there other ways that we can provide you opportunities to make money that is not illegal to do? So we really we'll try to embed it within that integrated care plan, but we will, in the egregious cases, we will tell people you can no longer be part of this program. So, we see this as one tool of many, kind of within what it is that we offer for people. And one of the big motivators of people diverting is that we were never allowed to give people access to the types of drugs that would match the toxic drug supply, despite ongoing requests to do so. We did want to have access to high dose hydromorphone and high dose heroin, if we could get that, in order to give people something that's much closer to what they want. So one of the motivations of selling hydromorphone was to get money to buy fentanyl, because we couldn't match it clinically, despite our efforts to ask the province to put these medications on the formulary, so that way we could then prescribe them to our folks. So in many ways, we've been set up for failure throughout this entire process, because the government hasn't nearly scaled the resources to match the level of the crisis that we're experiencing.
Hi guys, I don't want to get you on camera if you're not, no, but I'm just wondering, I'm doing a documentary about the city of Ottawa and situation with homelessness and addictions, and I'm just curious if is this a safe supply facility?
Yes.
Okay. And do you know if it has changed its operations at all in the past year? Because there were some changes, because some facilities had to.
Well, on the website it says that they're not taking in any more people or whatever, but when I emailed them, they let me come in.
Okay.
So I've been on it for 2 months, maybe.
Yeah.
So in that time, there hasn't really been any changes, but yeah, if you go on the website, it says that they're not running. I don't think they're allowed to publicly say that they don't run the program anymore, but they do still accept patients.
Okay, so they can't publicly say, but they.
I don't think so.
Okay.
That's what I'm gathering, because that's kind of.
Can I ask you? Do you feel like the city is doing enough for people in a position of need when it comes to this?
For me, yes, just because like I'm not homeless, and I don't know too much about like that aspect of it, but for me, it's been great. Like I'm not on fentanyl anymore. I'm strictly just on whatever they have me on here, like the Dilaudid whatever. So it's been good for me. I can't really speak for anybody else.
Right.
But,
well, I appreciate your insights and all the best.
yeah, thank you.
Thank you.
very
Yeah.
much.
Thank you. Interesting. You keep rolling there? Sorry. So that was a really interesting conversation. I didn't want to get that woman on camera if I could avoid it. We wanted to avoid that, but we're outside the Respect RX, the pharmacy recovery care here in downtown Ottawa, and again, we can't verify this information, but this woman told us that she was receiving hydromorphone, Dilaudid, from this facility. She said that she was under the assumption that this facility wasn't allowed to publicly accept new patients, but she herself is a new patient and said as much, and that they are actually accepting them and providing them with safe supply. Now, if that's the case, there should be an investigation into this situation, because you don't want to see anyone suffering. This woman said that she is feeling better. She is no longer using fentanyl. And again, if that's the case, that's a sign that this program can help people. But there's a reason why the provincial government have made the decisions that they have to stop these programs. And if there are facilities like this that are actually operating going against the law, well, that needs to be investigated as well.
Show that pictures, Mr. Courtney.
Sir, are you a resident? Are you a resident here?
Yeah.
Would you be willing? We're doing a video about the situation in Ottawa.
Yeah.
And I want to know, as a resident, do you feel safe in this city?
No, no way. No way. When you see the people using drugs in the street, and who's gonna be safe? Like, that person is not gonna save. The public in the street is not gonna save. And the police officer is walking away and he watching everything. And I grow up here. Look how we look like Ottawa. Look Ottawa back, and look now how we look like. Is Canada? That is Canada.
Right.
The country we love it. It's difficult.
Quick question for you. The last one. I want to let you go, but I want to know, because the city of Ottawa says that that actually there have been improvements made in the city over the past couple of months. Do you feel like that, or do you not feel
They can take these people in the hospital. They can make him nice. They can give him. They can take him from the street. Where is the government? Where is the Canadian? All this human, man, right?
Would you like to see many of the people here put into recovery systems?
Yeah. You have to take these people to the healthy. Look how it look like downtown Ottawa.
Right.
And look like 10 years ago how it looked like. Beautiful country. And now the people, they say we are like different country.
So right now we're still in downtown. It's Nelson and Rideau Street. Rideau Street's kind of notorious in Ottawa, unfortunately, but just a block down there is a safe supply site, which we spoke to a woman out there who gave us her story and how the system has been helping her, and that's great news, genuinely. A block across here is a safe consumption site. Again, that's a place where addicts can take hard drugs, toxic drugs, which they get from the street, and consume the drugs in a safe environment where if they do overdose, they can be quickly revived, they can receive some services. Potentially there are counseling services involved in this building as well. Typically those services are packaged together from what we can find. And we just spoke to a gentleman who shared his story, gave us some insight into this building, and I asked him about misconceptions people have about people struggling with addiction, misconceptions about the situation here. This is what he had to say. Is this facility a safe consumption facility?
Yeah, it is.
And is it also a safe supply site?
Safe supply, no, that'd be up the street.
That's the pharmacy?
Yeah.
And is that site still operating?
Yeah.
Yeah?
Yeah.
And if you don't mind, if I could ask you, do you feel like the city is doing enough for people that are struggling right now? Are there enough facilities for people to get clean and to put them on the path to recovery?
Basically, the home situation, that's pretty bad.
Right. Apparently, it's record homelessness.
Yeah, and plus the hike of the price of food and whatnot.
So that's
Survive.
a big factor for what we're seeing in the streets. Do you feel safe in this city?
I feel safe enough, but there's the odd character you have to watch for. I mean,
Right.
I wouldn't be outside at 2, 3 in the morning,
Right.
especially at my age. But other than that, it's not a bad city compared to other ones that I've seen.
Yeah. Last question I have for you. Do you think there's like a misconception that people have about the situation here in Ottawa and more broadly with homelessness and addiction?
I believe so.
And if you don't mind, could you explain what you think is that misconception?
Well, a misconception. I mean, most people seem to judge people that are on the street without really knowing what the situation is. You know, we're being judged, and it's like, until you put yourself in our shoes, you have no clue what we're going through.
Right.
Basically. And we turn into drugs and alcohol or whatever because we feel sort of depressed and left out.
Right.
You know?
Sir, thank you very, very much for your time. God bless you. Thank you. Hi there. I want to introduce you now to Natalie Bergen, a mother who has had to endure unimaginable tragedy when in 2022, her 21-year-old son died after overdosing on laced Xanax. Bergen and 2 other mothers who have had to endure the same tragic experience of watching their children die to this opioid crisis form the advocacy organization Trace the Lace, a group that tries to pressure law enforcement agencies to charge drug traffickers with manslaughter and murder charges after selling lethal laced drugs to people on the streets. Can you tell me about what motivated you to start this organization?
Absolutely. My 21-year-old son, William Bernard, passed away in April 2022 from laced Xanax. It wasn't fentanyl, it was fluoromazolam, which is 20 times stronger than Valium and doesn't respond to Narcan. So I was shocked that we're not going after to find out where the drugs came from.
When you look at some of the policies that have been put in place in the city, safer supply programs, safe consumption sites, from your perspective and your experience, how has that impacted how has it impacted or changed the situation on the ground here in Ottawa?
I can say that there's 2 opposite views here that are very polarized, and one of them is all about safe harm and the other one is treatment. We're not saying safe harm doesn't have a place. It does, but it's near schools, its children are seeing this, it's near the residents, they're witnessing this. This is not healthy for the community. It's not healthy for the businesses. We are advocating for immediate government-funded addiction resources, whether it's residential, outpatient, detox. We want that available right away so that the person is able to make a choice.
Right.
And the decision right now in Ottawa for residential treatment, it's a 6-month wait list to get in. And so we're saying, no, let's give them some hope at the beginning and a way out.
Right. And you were telling me before we began recording about how there are documented cases of drug dealers and traffickers that loiter around shelters.
Yes.
And around these safer supply sites. Like, to me, that is an issue and a story that is underreported.
It is, and I'm hoping to work with the police to sort of safeguard what I found in my research and my experience as a mental health social worker is that these drug traffickers are going to the vulnerable, they're attacking the vulnerable people, and they're going to places where they're trying to get help.
Have you seen political support for your organization and your cause? Has there been some buy-in from politicians at either a local, provincial, or federal level?
We did. We had the Conservative MP in the PN helping us. I think I've reached out to the Liberals. I haven't received any support other than my former MP, which was Chadna Ari. There's no real drive that I find that politicians are ready to look at this. I'm telling every family, every parent, that we need to get together, we need to be strong, and we need to tell the government that we want more done. Drug traffickers are getting, if they go to jail, they get released. And then an overdose death happens. How is that happening?
All right, so we've just actually moved to Ottawa's Chinatown, and over my shoulder, that building with the Canadian flag with the red barrier there, that is allegedly a safe supply site operated by a company called New Dawn Medical. The reason we're here is because just last month, the former occupant of that building, Northwood Recovery, was shut down. The city councilor for this area, Ariel Troster, as well as the business improvement area president, panned this structure behind me. They were concerned for the residents' safety. They said that diversion of hydromorphone tablets was becoming a serious issue here. Open drug use in this area was causing serious problems. And when they heard that Northwood Recovery was going to be shutting down, they rejoiced. They said it was good news. But a week after that, again, this is all just taking place last month in June. A week after that, the site reopened under a new name, New Dawn Medical. Now, I want to read to you some of the quotes about this area from the business improvement area president, as well as the city councilor for this area, Ariel Troster. By no means a conservative, by the way. This woman is a liberal. It's safe to say that. Yet she has grown tired with Safe Supply. She doesn't believe the program works. It's an example of how Safe Supply is no longer politically accepted by both the left and the right. So I want to read to you what she said about this site opening up. This is a huge betrayal of trust to the community. It's a huge betrayal of trust to my office and to the people who tried to work with the clinic to see if we can mitigate the problems. Remarkable. That's from the city councilor here. The president of the BIA area, she wrote the following: I'm not getting a sense that it will be much different. I can be hopeful, but why did they not contact us to let us know they are coming in? They are reopening the facility.
Now, there's something different about New Dawn Medical than the other operating safe supply sites in the city of Ottawa. New Dawn Medical has no branding. There's no logo on the front door that says to the community that this is, in fact, a safe supply site. Online, there is no listed address. Really, if you're looking for it online, you can't find it.
All right. We're going to go to this facility, and one of the things I'm trying to do is to confirm if this is indeed New Dawn Medical, to confirm some of the ways at which New Dawn Medical operates. So we've heard that this facility, like other safe supply sites across the province, offer virtual consultations. So people who are struggling, who need help, only have to go to do a virtual meeting to get a prescription to then receive hydromorphone. Hi there. Quick question. Is this New Dawn Medical?
Yes.
This is New Dawn?
Yes. Can you not film me though?
Yeah, no problem. We won't get you on camera. I just have a couple questions about New Dawn. We're making a video about homelessness in Ottawa and addictions.
Okay.
Is this a safe supply site?
It's a medical center.
Medical center? Do they provide? Does New Dawn provide safe supply?
Yes.
Yes.
Wait, what is it? Safe supply. Oh, yes. Drugs? No. Safe supply. Yes.
So they do.
And among other things.
Okay. Yeah. And I was told that this site does virtual consultations and in person. Do you know what the ratio is between like virtual to in person?
It's a good mix of both.
Okay. And do you work here by any chance?
Yeah, I'm the lead.
you guys have a policy to prevent diversion of hydromorphone tablets from this facility?
We do, but it would be a lot to explain it to you right now. So, but yes.
Okay, and just very briefly, does that include, trying to ensure that hydromorphone is taken on site and not taken off site? Is it almost like impossible to prevent hydromorphone from leaving the site? Because isn't it like hard? Because when so it's kind of there is some people do have to take it off site.
Yes, but we limit how much they take.
Okay.
And we also have changed policy so that the brand.
Right.
Fentanyl is so strong that we need something to cancel the withdrawal.
Yeah. That's what we're trying to learn more about it and balance out what we've been hearing from the media about it.
Another policy we changed was the brand of medication because the old clinic that we used to be with, the brand was they were able to sell it on the street. The brand that we use, so we have been able to.
Thank you very much. Appreciate the time. Thank you. All right, great. So there we go. We got some insights. This facility does operate Safe Supply at this facility, and they do have some policies to prevent diversion. One of the main issues that people have with Safe Supply, which is diversion. Part of that, as we just heard, includes ensuring that they limit doses so that not as much Dilaudid gets onto the street. Part of it includes taking the Dilaudid in the facility. But of course, as you heard there, preventing Dilaudid from getting onto the streets is basically impossible, because what are you going to do? Force people to take the drug, all the drugs they get at that one time? Of course, it has to leave the facility. So that's some interesting insight here from New Dawn, formerly Northwoods Recovery, now New Dawn. There you go. Is there a message that you want Canadians to know about the work that you're doing and about William, and anything else that you want to say to people watching?
Yeah, I want to tell parents that we all need to stand together, but not only parents. I want to focus on all friends, loved ones who have lost people to lace drug overdoses. Let's join together. Let's fight this. Let's make it right. Let's respect their memories of our lost ones, and let's prevent more unnecessary deaths. These are tragic deaths. They don't have to happen, and it's time that we do something about it.
Wow, what an interview with Natalie Bergen from Trace the Lace, a woman who lost her son, a mother who lost her son far too young from laced drugs, a situation all too familiar across this country, and one that we're not, in my opinion, addressing enough. The situation here with drugs and addictions has become polarized. Advocates for safer supply and harm reduction are fighting with advocates for recovery. Frankly, that's not going to lead, in my opinion, to us solving this problem. It's one that requires all levels of government to address and to take seriously. I want to make another point about this video clear, which is that this video is not to diminish people who are struggling. In fact, it's quite the opposite. I want to shine a light on what's going on here and start a conversation as to whether or not these programs are working. Because if they're not working, they need to be changed. And if they are working, well, they need to be rolled out across the country. Also important to note that what I showed you here today of Ottawa is not what the entire city looks like. This is a beautiful city still. It's got amazing neighborhoods that are wealthy, that are thriving, with patriotic people who live here. This was the downtown core of Ottawa, the main tourist area. I showed you the ByWard Market, I showed you Rideau Street, I showed you Chinatown, because that is where the drugs and addiction crisis is most prevalent. This is not the whole city. If you want to see me report more on the drugs and addiction crisis taking hold in our country, be sure to like this video, subscribe to my channel, and share this video with your networks. Signing off from Ottawa, Harrison Faulkner.